medicine virtual, which is our telemedicine services that we offer within our pharmacies that are within the communities. Further to that, I also participate in having health screenings at our different facilities where we do free consultations, do blood pressure check, random blood sugar. We also have special programs for clients who are diabetic and hypertensive, where we enroll them to a program where they receive health education and coaching on how to manage their conditions, as well as we run patient support programs in partnership with other companies where we provide access either to medication and other devices. So many programs, including a malaria program that's for children under 5,
right?
And basically things around healthcare.
Wow, it sounds like you have a very long agenda for things to do.
Harriet, who did you work with before? Was it that medical company that you're partnering with the pharmacy store? Meridian.
Oh, yes. Yes. So Meridian, is a medical center. They are a chain of hospitals. So previously we ran the pharmacies for them. So we would have a Meridian, and then the pharmacies will be run by Halton. So we basically used to serve their patients, both the insurance and walk-in patients, provide for them medicine, vaccination, and any other services from a pharmacy end.
So how many of the Halton stores have now been converted to your outsourced pharmacy with Meridian and maybe others?
With Meridian, we had a couple, but our contract ended with them. So right now, I think we have 2 branches left, but they kind of took over the pharmacies. So they're managing their pharmacies as we speak. I think we only have 2 branches that are left where we outsource the pharmacies for them. But previously we had, let me just confirm, around 10, 12 branches.
Okay.
Meridian and Halton's,
And then how many retail stores, Halton stores, do you have?
Oh, I'd say over 40, around 45. That is in if I count together plus the partnership we have under the QRX model. And that's why Charles is also important in this call.
Great. Thank you, Harriet. And Charles, why don't you introduce yourself and then tell us about the QRX. You're on mute.
Thank you, Nancy. Hi, Elliot. So
Hello.
My name is Charles. My name is Charles Kagiri. So I run the franchise model, and technically what we do, we partner with individual pharmacies, just the local mom and pop pharmacies. Good. So that's our growth. That's our growth model for this year. So currently, I have 33 facilities on board, and we're looking.
Excuse me. I'm sorry. How many?
33.
33. Thanks.
Yes. Yeah. So so what we do is that we'll just come to start conversations with the individual facilities. We look at what the needs of the facilities are. Some of the benefits, of course, that we'll bring in is that we'll try and make sure that their shelves are always full by us replacing the normal supplier. So we come in and become the supplier, the main supplier for their inventory. So the other solution that we'll offer to these pharmacies is that we actually co-brand with them. So the facility will still retain their name, but we have one umbrella brand known as Multi Pharmacies. So the other benefit that we'll get, of course, will help them in their general marketing. So we do health screening, community engagements, all the other services that Dr. Harriet is responsible for. We'll incorporate them to these individual pharmacies. So so basically how this works is that we'll come, if Nancy is a facility owner, will come and engage you, speak to you, try and identify the challenges that you might be facing. We do have a standard 5-year agreement. So we'll allow you, once you feel like you would be willing to partner with us, we allow you time to review the agreement. We then have a sitting with and look at the agreement together. And once you feel comfortable, we then sign up. And that becomes the start of the partnership. So after that, we'll come and give you a point of sale. Because most of these pharmacies, as we know, do not even have a POS. So actually keeping records is a bit difficult. So yeah, so we have an internal POS known as Bloom. So, and we give to this facility owners for free. So they actually, so the POS actually helps them manage both customer data and also their inventory.
Good.
So, yeah. So, and the reason why I'm here is because in the area that we want to partner in, we need a brick and mortar store. So, and I'm tasked to look for pharmacy owners and then get them and actually try and get maybe 1 or 2 facilities in Kibra whereby we can use it as our reference store. And so at the moment, I've nailed down to 2 facilities just in Kibera. So we are in the point of contract negotiation. I gave them the contract. I allowed them to just review the contract and maybe probably come back with any concerns that they have or anything that they needs to be addressed. So I'm very hopeful that by the time I'm going back to them, we can actually have, you can actually sign them, both of them, or even not one. So that's it.
Great. Oh, thank you. I just got a message from Abdul. He thought it was an hour later, so he's going to be joining us in a minute. But
Harriet said somebody's in the waiting room, Anthony.
No, there's no one in the waiting room.
Oh.
So I don't see anybody. She asked, she was just saying, could you be in the waiting room? I don't see anybody in the waiting room. So we'll just continue. So Elliot, why don't you give a brief description of yourself?
Okay, I've had a career. I'm in the US in Washington, D.C., and have done a lot of things, variety of aspects in healthcare and public health. And for 50 years now, which tells you I'm pretty old, but keep trying to move ahead. I've had a number of activities that have gotten me involved in looking at medical centers. I was an assistant dean at the Yale School of Medicine and its hospital, and I worked for Congress on a number of laws, including some that overlap with what we're looking to do now. And one of them, which is, I think, pretty relevant, is having worked on creating laws that created community health centers. And I feel very strongly that Wayo has a chance to become one of those. And also I did, I don't know if you know the group MRSA, which is a human resources consulting group. I was its national person for healthcare. And in that capacity, worked with a number of large Fortune 100 companies, including setting up healthcare programs and drug programs, including for the United Mine Workers Trust Fund, which we created a whole program for all of these retired coal miners and their widows, and a database of how to manage them for medication management, which, as you probably know, people over the age of 60 and 70, particularly here in the US, are often taking 6 or 8 different medications and over-the-counter things, and tracking them is obviously very difficult. And what I've tried to do, we're in early stages of it, but pretty exciting, which I hope can lead to a strong partnership with you all at mPharma, is I've got 2 MPH, I have a program, Healthy Futures, at the University of Maryland, and I have MPH graduate students who are interns with me. And we're putting together a maternal and child health program to cover the 2,000 boys and girls who are playing soccer and their families. So we've got a population of about 8,000 that we're really hoping we can set up a maternal and child health program, including medication management. And I'm thinking that it could easily become a community health center, whereas people from the neighborhood and the local area folks who could be in the thousands would have a place to come and get the kind of things you were talking about, Harriet, to make sure that that they're being tested for hypertension, being diagnosed for a whole lot of other things. And as they need medications, to have it available, that you would supply it to that center. I think it's a little bit different than the model that you have it, but it could easily integrate with what you're talking about, Charles, having 2 pharmacies set up and link with them and be able to provide things much more in the villages that are there in Kibra. So I've moved a little bit away from myself, but I put on the table something that may be worth exploring as we go forward together.
Okay, there's a Fatima Hassan who joined. Is that, and you're on mute. Harriet, is that one of your folks? Everybody's on mute.
Yeah, could it be Milka? Because she told me
Milka.
she was joining.
Is that Milka?
No. She's having problems logging in. I don't know why.
Okay. Yeah, so is Abdul. So I'm not sure.
Hassan, maybe it's Abdul.
No, it's a different last name. Fatima, you're on mute. So that name doesn't ring a bell with either of you. Well, it might be, I don't know. Whoever it is, welcome. Whoever you are. And okay, I'm just gonna, for Charles' benefit, because I already met Harriet. I was a Stanford Seed.
Hello.
Oh, Abdul? You're on mute now.
Yes.
Okay, you're on mute.
Hello.
Okay, we hear you. Can you hear us? He's having trouble too. So I hope, well, we're recording. So everybody who, Milka and anybody else I'll send a copy. Okay, Harriet? And Charles, you too. My background was, I lived in Kenya, East Africa, as a business coach for Stanford Seed program, which is to help African SMEs become successful, very much like a mPharma when it was younger, earlier in its stage. And I met the Kibra folks through Abdul in 2017 when I was still living here working for Stanford. And I got involved with the soccer program that he had started up in 2016. And it only had, he only had about 80 soccer players, boys and girls. And now there's over 2,000 in the league that he's involved in Kibra, boys and girls. And what happened, a lot of those young people grew up into young adults. So my focus is now on what I do in my life, which is business development around the world, entrepreneurs, helping people come up with self-employment. And in Kibra, it's especially important. So, oh, here comes Milka. But before that, in my industry background, I had been in many years ago in the large retail chain industry with thousands of stores in a chain. Not with pharmacy stores, although I coached pharmacy stores in Nigeria, but I worked with inventory management and inventory control for the retail industry. We set up the first, very much what mPharma has done with pharmacists, we did with all kinds of retail stores, apparel, hard goods, food, etc. So I'm a strong believer in what mPharma is doing. And it's interesting because in the largest retail chain in Nigeria, which has 20 stores and doing about 50 million US dollars, they did not have a merchandise plan and inventory control software program, which I helped them install. And now they're profitable. So, you know, you're preaching to the choir when you tell me what mPharma is doing, because I know it is the only way to success for chain stores. So that was my pertinent background for being involved with mPharma. And one of my coach friends, actually your founder, when he first started mPharma, her name is Liz Bond, which you, Harriet, might have met at some point. I think she was here in Nigeria, in Nairobi this last fall. She was working on a project for mPharma. So anyway, so that's where we all are. And Milka, welcome. And you're on mute. And if you want to unmute yourself and just explain to Elliot, my colleague, what you do for mPharma, that would be really, really helpful, if you can.
Hi, Nancy. How are you?
Hi, how are you?
I'm very well, thank you.
Good. So
apologies. I was having a challenge joining the meeting. Finally, I'm here.
Oh, well, listen, we understand. This happens a lot to all of us.
Okay, thank you.
And your role, why don't you explain to Elliot what your role is in mPharma?
All right. Hi, Elliot.
Hello.
So, at mPharma, I deal with retail pharmacies. You can hear me?
Yes.
So I'm the retail lead, and my job is to make sure that our pharmacies have everything that we need. And we also responsible for making sure that we are looking for business, marketing, and all that.
Great, thank you.
Yeah.
Thank you. So we have Abdul. I'm not sure, can you hear us, Abdul?
Yes, I can hear you.
Good, good. So Abdul joined us. Do you know Charles and Milka and Harriet? Abdul?
Yeah.
Do you know Charles and Harriet and Milka from mPharma?
This is maybe my first time, at least I will know them. Will be my first time.
Okay.
And if possible, if I can get like a brief introduction about them, then I will appreciate.
Okay. You missed the beginning, but Harriet, why don't you just, and Charles?
I'm sorry for that.
Okay, Harriet, why don't you repeat what you do for mPharma for Abdul?
All right. Hi, Abdul. Pleasure to meet you. My name is Dr. Harriet Onwanga. I'm the Health Services Manager for Kenya mPharma. what I do in charge of primary healthcare, that is via our telemedicine platform. And also I run patient support programs in partnership with other companies, as well as disease management programs such as diabetes, malaria, and hypertension, among other things.
Great, thank you.
Yeah.
And Charles. And you're on.
Hi, Abdul. So my name is Charles Kagiri. I'm in charge of the franchise model, which we call QRX. At one point, I actually gave your contact to one of my colleagues to reach out to you. So when we were just prospecting for facilities that we can partner with in Kibra. So I'm actually responsible for bringing in these partners into the model. So thank you.
Thank you. Now, Abdul, who was the person you took around Kibra? Abdul?
Pardon?
Who was the person? Who was the person from mPharma that Charles introduced you to? You took him around Kibra.
His name was Jeremy.
Jeremy. Jeremy.
Jeremy
Right.
mPharma.
Good.
Yes.
Jeremy mPharma, yeah.
Great. Now, okay, I think we're all introduced, and the main purpose of this was to return back to how we in Kibra can work with mPharma to help you grow your business there. And so Harriet or Charles, do you want to lead that discussion? Tell us where you are there. We know you were looking for 2 partners in Kibra, and that I think Harriet said that you had been stalled in terms of your discussions with people in Kibra, and then that's the last we heard. So maybe if you can bring us up to date, that would be very helpful.
Exactly. So thank you, Nancy. I think so. From the visit that Abdul and Jeremiah did, I got a list of facilities that could potentially be potential partners. So after review, the biggest challenge we had is that most of them did not have the required documentation.
Right.
So in terms of regulation, because mostly the regulator will not actually go to Kibra, and you realize what happens is that even by the time they go, these facilities just close for a day and they open the next day. So that's how they operate. But we want to bring in structures. We want to come and upgrade them, and it requires that we must ensure that they have the basic minimum requirements. We're not looking for much, but we just need to have the basic minimum. So actually the thing is that the biggest challenge for me has been out of those candidates, I wanted to nail down on the potential people that can actually are willing to get the licenses and documentation. If they need assistance, I support them. So I had to actually engage all of them from the list. And these 2 who are actually along the main road are actually the ones that showed interest in terms of acquiring these documents. So we had agreed on a timeline of 1st August to ensure that they have the full set of requirements. So that's already agreed upon. We have a timeline, which should be next week. So the next hurdle that we need to cross is that we need to agree, because we have a financial model whereby once we get into an agreement, we'll need to share revenue with the facility so that we can get our income. So they need to agree upon that. There are different modalities and clauses in the contract. Of course, signing an agreement would require you to maybe review with another partner, maybe review with a lawyer. So, and maybe just seek clarity in terms of the actual clauses in the contract. So that's where we are at. So I just have allowed them time. So this week I'll be getting back to both of them. I wanted to do that earlier this week, but we had a conference that most of the facility owners had visited over the weekend, so we couldn't do that. So unfortunately, now the visit, this call came before the visit. So I'll just do the visit after this call, probably tomorrow or the day after, just to go and sit and discuss the agreement, make the amendments that are required. And if the moment we get the first contract signed up, we just go all the way to mPharma in Ghana and seek approval to proceed.
Well, congratulations, Charles.
Yeah, that sounds good. Charles, I
Yeah.
have a question on that.
Yes, Elliot.
Of
Yeah.
whether it's possible to begin to do something simultaneously. We've noticed on your website that people can just go ahead and apply and get a Muti card. Would it be appropriate, helpful if we started reaching out and getting what we look at as the 2,000 players and their families? It's a population of about 8,000, to see if we could begin to get them Muti cards. And then when you can complete the contracts with the one or two facilities that you're negotiating with, they could begin to get related to those facilities. But in the meantime, if they have like going to a hospital and getting prescriptions and all, they still might be able to take advantage of the discounts that you're able to provide on the Muti cards. Does that make any sense?
It does. Thank you, Elliot, for the question and the idea. The thought behind it is actually very nice, and that is doable. However, in terms of, we just have maybe to figure out with Milka in terms of logistics. Once we get and the client has a prescription, how best can we serve them? Because the idea and the reason why it's very important for us to have a facility is just to ensure that we can actually be able to serve them from their nearby place, which is Kibra. So if we are there physically, then it makes a lot of sense, because also during registration of the Muti cards, we actually register based on location. So you'd find that people within a certain radius are actually registered at that particular facility that is within there. So if we actually wanted to get the data, we get it per location. So if the concern here is, if we register them now, we might register them in other locations and which are not actually where they are. So in future, if we want to reach them, it might be a challenge, because we might contact them based on location, but they are not actually in that location.
Yeah,
so
Charles.
Yeah,
oh, I'm sorry.
yes.
Yeah, I was going to raise that question because Kibra is huge.
It's very huge. Yeah,
it's huge. So if you could tell us, where are the two locations that you're talking to now, because that would answer the question of,
exactly.
We would have to, target around those locations, not just generically. So where are you? Said they were on the main road, on the drive?
Yes. Actually, they are along Kibra Drive, so which is just next to Equity and KCB Bank. Abdul should know the area very well.
Okay, they're both together then, near there.
Yes, it's a radius of maybe probably a kilometer between each other.
Oh, good. And is that, Abdul, you're on mute. Is that close to your area? Yeah. Is that close to your area?
Yeah, it's just a walking distance, something to do with like half a kilometer's walk, something which at least is reachable.
Okay, good. Is that work, Charles, a half a kilometer?
Sure.
Yeah, it works. Sure, works very well.
Okay, good. Okay, because that was my concern when you were talking about the locations. Great. Okay. So then back to Elliot's question, if it's close to the 8,000 people, does it make sense to start signing them up?
Well, let me ask you, Abdul, you know all of these and you know them by the villages and all. Are these two facilities within the village that you have most of the players and their families?
Majority of the players are coming from Makina villages, but where the facility is, it's in Kianda village and around Katwekera area, where we don't have like much players, but accessibility from Makina to that place is just a walking distance.
So,
Okay,
that would not be a problem. That could be a plus to be able to say, you know, if we start doing it, and as soon as we finish, you know, we'll have that call later ourselves with the two MP8 students where we've got that database already to start enrolling people. We could combine it with the Muti sign up, and that would be very helpful, because what it might do for you, Harriet, among other things, is we're gathering enough information about those who have chronic illnesses, particularly like hypertension, which you mentioned, and some of the others. And we may be able to just get some things underway. I'm always too optimistic, but getting it some together over the next few months, certainly before the end of this calendar year.
Charles, yeah, maybe you could give us some feedback on how that would work in your planning. Oh, Charles is on mute.
Hello.
Hello, Charles.
Yes, so I'm here. So I think it makes a lot of sense too, because also I think from what Abdul will tell you is that even I've seen most actually of these clinics that I'm not sure where they go to get their prescriptions. Abdul, maybe you can just give us some information around that. But I would think it's within the same area, because I saw a few clinics around that whereby the facility, the pharmacies are. So it will be convenient if actually the clinics were within the same area. So Abdul.
Abdul?
Hello?
Yeah.
Yes.
Can you answer?
So,
yeah.
Yeah, majority of the pharmacy which is around Kibra, yeah, you can see them operating, but you never see when there is some drugs being brought to those pharmacies. I don't know like exactly where they are getting their drugs from, but I think they have like connection with the guys who are working in the government sector, which at least they are delivering for them those drugs indirectly, which is in most occasions. That's why you can realize that majority of the pharmacy, they are not licensed, but they don't have like a clear certification on how on operational. But when it comes to like drugs, they are fully loaded with the drugs in their cabin. So I'm not sure where their drugs are coming from, unless if I just do my investigation just to see exactly how they are getting their drugs from. But majority of them will not let you know exactly where they're getting from their drugs. Even trying to investigate on issue of their compliance in terms of the license, most of them will not tell you that they are legal registered. And if you try to interrogate, they think that you are sent by some department so that you can come and investigate them. And their fear is whenever they give you like the information about their pharmacy, their chances of that pharmacy being closed to be so high because they don't know exactly where you are going to report that information from.
Now, Charles, back to your two businesses that you're dealing with. What is the timeline from, what if they, you said August 1st, when would you expect, if everything goes well, that they would be signed up with you and you would start working with them? How many months does that take?
Actually, the biggest hurdle is that it's just accepting to the terms of the agreement. Once that is out of the way, it takes us on an average 2 weeks to get us set up, to have the POS in the facility.
Great.
And to have inventory in the facility and start now registering clients on Muti and actually doing the actual dispensing. So it's on an average 2 weeks.
Good. So, okay, so it sounds like our 2000, Abdul, right? Our 2000 players are going to be within walking distance from these two locations. Is that correct?
Yeah, that will be possible.
Okay, good.
Yeah.
So that's great. And okay, then the only thing, I guess, Charles, is if you are agreeing that this would be a good idea for mPharma to have the Moody, as Elliot outlined, there would have to be training for Abdul and his CHWs. The CHWs are the ones who would be doing the signing up. They would need training on how to go and get all this information. Have you done that in the past with neighborhood groups?
Oh yeah, we do that, and that's where Dr. Harriet would come in, would select some trainers, train maybe Abdul to train a few more people, and would actually come in and follow up in terms of the execution itself. So we do that, and that can be done.
Oh, good. So you have lots of experience. Yeah, I would assume you would have lots of experience. How many people would you need to cover the 2000? Oh, Harriet has her hand up.
Yeah.
I'm sorry.
Oh, yes. So in terms of the Muti registration, so we have a number of platforms where we have the clients registered to Muti because they have to consent to being members of Muti and then understand what the benefits of Muti are. So what we normally do after we've set up a facility, maybe that, say, facility X has been identified in Kibra, then we officially launch that facility whereby we have a health screening where clients walk in, they are told about the free consultation, free random blood sugar and blood pressure check. And at that point is where they're registered on Muti and explain to what the benefits of Muti are. So in that point, you're also able to capture a bit of Muti clients. And then even as the facility owner or the pharmacist within the facility see clients on a daily basis, they're also able to register clients onto Muti. And even then you realize that they might have picked some people who are already members and probably are just coming in to buy some medication. Then another platform is under the Muti Doctor, that is the primary care, where now we have a nurse who sits in the facility to aid in telemedicine, to connect the client to the doctor virtually. So attached to that, we have 2 community health nurses or community health workers in this case, who go around doing screening and registering clients on Muti and explaining the benefits and informing them that whenever they need to see a doctor, then they should present to themselves at the nearest pharmacy where they're able to get the free consultation. So I see them as all those 3 avenues as a way of registering clients on Muti and for them to understand what the benefits of Muti are. But it's not such a hard process. It just requires your name, your phone number, and your date of birth. So I think, yeah, that should be it.
Okay, well, that sounds great. So how, Harriet, and Charles, how do you see, and Milka too, how do you see how, you know, Wayo and Abdul and his CHWs could work with mPharma on a formal basis to get these 2,000 families registered, you know, starting with once they sign the agreement, because I guess we don't want to do it until they sign the agreement. And that should be hopefully soon. So how have you worked in the past with different groups like this?
So, so I think we have, I would propose two options. Number one, and Abdul can give us feedback. If we were to do the official launch and we actually invite these 2,000 people to the facility for registration, are we able to actually ensure that they all come? That's a question that I have, because if not, then we can find modalities with Harriet to actually go to a convenient area for them, register them remotely, but also again, give them the benefits of MUTI and ensure that we communicate to them where the location of our facilities are, so that we tell them, if you want to actually enjoy these benefits, you'll go to facility Y along the Kibra Drive. So I float to those two options for us to discuss and agree which is the most viable.
Well, you know, we just had that health fair on June 11th in the DC area under tents, and we had hundreds of people there, and it, you know, Abdul with a fellow from the Ministry of Health really engineered everything, and we had our CHWs there volunteering as well. Abdul, do you think the DC area would, you know, with tents and tables and sign up like we did for the health fair where everybody was registered? Would
Before
that
you
work?
answer that question, Abdul, I have an added one that maybe doesn't make any sense. You have, you know, your essentially you have your office, you have a clubhouse and all as a facility. And I know you're looking to potentially expand it with, you know, a bigger container operation and all. Would people be able to just come to your office at fixed times and be able to get the signing up and all there?
It's a little small, Elliot. It's very small. You know, only about 20 people can fit in there. I'm thinking if you have the big fairgrounds, people, you know, people can be like the fair, you know, it's a huge area. And
I'm not saying that's not a really good idea, but it requires a lot of planning as opposed to having an office where people can come at their convenience.
I don't know. Abdul, what do you think?
Can I have
I think,
a
what Charles is talking about is like community awareness about the multi benefit.
Yes.
We have like different options which we can do. One, we can have like, we can go around the community and sensitize the community about like the multi thing through like either we have like a van going around different villages. Two, we can set a tent whereby in an open field where it's at the DC field, whereby also we can do like registration of the community members about like the meeting by through creating awareness in the community. Before that, at least we can work with the community health workers whereby they can sensitize the community. And then the D-Day, they can all avail themselves at the DC field whereby we can do like the registration. Oh, the third one, according to the 2,000 players, what I can do, I can communicate with all the community coaches, whereby I can tell them about the importance of the multi and also what is coming up, the opportunity we have from the mPharma through the multi benefit. and they can still get that information to their players, and the players can get information to their families. So what we can do, we can make sure that all the soccer players, they can avail themselves at the DC field, whereby we can also still do the registration. If the facilities is ready, if the two facilities is ready, it's also another thing whereby the community health workers can mobilize the players and send them to the facilities where the MUTI or the mPharma decided. I work closely with the pharmacy to at least to start the two pharmacy, so that the client can get like those information. All the option we can have like a discussion whereby the way Nancy have just said, when we had like our health center, we had like a lot of discussion before the D-Day. All things are possible. It's just a matter of putting things in place and knowing which are the priorities, what are the precautions, what are some of the things we are supposed to do prior to the D-Day, and everything can work well.
Yeah, thank you. I told you Abdul would have great ideas. I was, because that's a lot of people at 2,000, and we don't want to miss the opportunity to get everyone a chance to be able to sign up for the Moody card and understand, because a lot of people, we saw even with the health fair, a lot of people are not aware. They don't have internet. They're not going to go online to read about the Moody card. So it's going to take some education. And so I think we have to work with mPharma to see what they've done in the past with education materials, and then educate our folks so they can go out and be very effective.
So maybe if I have a question for Charles. I'm asking, is it before like the launching day of the two facilities? Is it possible the information should go to, also we should make sure that the Ministry of Health Department, where they are in charge of the health facility in Kibra and also in Langata, should we give them information about what will happen, because they are in charge of health in these two areas?
So I'll invite Harriet. So Doc.
Sorry, please come up with that question again.
Have like the Minister of Health representative in Langata and also in Kibra, in case any activity which is being done in terms of health information, they're supposed to inform them prior so that they can be part and parcel of that information, or else in most occasions they normally shut down or stop like either the activity or maybe the program which are there.
Okay, I think that's something we will look into and find out more details about, because currently the programs we are running, because mostly they are within the pharmacy, and if at all we are running any other programs that are outside of the pharmacy, most of the time we tend to just deal with the county, especially if it's more of like marketing your product, then we have to deal with the county in terms of getting licenses for marketing. But we've not partnered with MOH in any of the programs.
Yeah, Abdul brought up a good point, because when we had the health fair, we met with the head of the health fair in Kibra a week before, and she was telling us about some people, usually international people, who are coming in and giving out medicines and doing, something in health related. And she was very irritated that they hadn't come to her to make sure it was okay. And so what Abdul brings up could be something real. I'm sure it'd be fine, but would have to go probably out of courtesy through Dr. Asma and Wycliffe at some point in the planning. So
I
Harriet,
have a question for you, Harriet. You've mentioned, which I'm very intrigued by and have done things off and on for a couple of decades, about telemedicine and all. Do you have a group of physicians, I guess, who are currently available to help either do some diagnosis or do some prescriptions for residents? It's certainly not enough physicians in in Kibra, and I'm not sure how that relates to the actual pharmacies, but I'd love to know, do you run the telemedicine thing on a separate platform with a separate track for it?
So for the telemedicine service, we do have a device known as the Title Care. That is what we use for the telemedicine. So it connects the client who walks into the pharmacy to a doctor who is seated at a health facility. So we have the health facility at Karen. That's our licensed facility with a valid telemedicine license to allow us to operate that platform. So the doctors normally sit there, and when a patient walks into the pharmacy, through the Title Care device, they are able to connect to the two doctors virtually. So they're able to get a consultation and get that prescription at the pharmacy. So that is the model that we're operating as of now.
So at this point, it goes through the pharmacy. I was wondering if sometimes some of the, let's call them the population we're talking about of the 8,000, the 2,000 families, if some of them needed to see a physician some way, do they have to go through the pharmacy, or can they go directly through an arrangement that you have to the telemedicine physicians?
So any client who needs to see a doctor for whatever reason, they are able to walk into the pharmacy where they meet the nurse or the healthcare worker who will be able to assess them, temperature, height, weight, and blood pressure. Then they are able to get their presenting complaint and then connect them to the doctor where they're able to get advice. Should there be that we have anything that is a bit complex beyond the scope of which we can manage, then we always refer them to the nearest facility. Though we still have some rapid diagnostic tests like malaria, HIV, pregnancy, that sometimes if the doctor feels that they need to prescribe that, then the nurse is able to aid in carrying out those RDTs, but these RDTs are purchased as well from the pharmacy. Anything that is beyond the level of care we can provide, we always refer to the next level of care.
And do you have then arrangements, say, with the facilities, like from what we gather, most of the people who go to a hospital go to one of the public hospitals that are on the edge of Kibra. Do you end up having arrangements with them, or do you have the people, say someone needs care, they go to a pharmacy, it's more complex, and that the telemedicine group knows that it needs, more developed kind of care that needs some facility. Does the pharmacy work that out, or the telemedicine one work it out, or should we start thinking about doing something like that within Wayo?
So what we've done in the facilities where we have the multi-doctor, which is our telemedicine platform, we have identified hospitals within the area that the pharmacy is located, whereby we do referrals for patients we feel that are not cannot receive adequate management from our level. So the doctor will do a physical copy of a referral note explaining what the diagnosis is, the reason for referral, and maybe the possible test that they may carry out in the next level of care. Then the nurse is able to print that out for the patient, and then they're able to be advised on the nearest facility where they're able to go with it. So most of the times you'd find people who walk in are probably maybe not so not very sick clients, I believe most of the time. But in case maybe someone is mostly in an emergency, of course, maybe the first place they'd rush to is a hospital other than a pharmacy. But we can look into ways whereby maybe we can connect the clients in the pharmacy with the hospitals. Maybe we can look into that as well.
I think we're coming up to 8 o'clock, 6 o'clock, and I don't want to keep you from your dinners, you and Kenya. I suggest that Abdul and Harriet and Charles and whoever you think should be in the planning and get together and come up with your idea of how you would go forward. Because there's, like Abdul said, there's like, 4 different steps that we could take with you. And let's address all those individually and then come up with a plan. So, everyone is on the same page of when these 2 facilities open, that you'll be ready with up to not quite, hopefully 8,000 Moody cards. So that's why I suggest, because it's going to take a lot of planning, and it's going to be between Abdul and you fellows, Harriet, Charles, and Milka. Does that make sense for you to meet and take it from here?
Sure, it does. I think us working together will be great to ensure that we can actually, maybe by the next meeting, we have all the modalities in place and we have agreed on all the technicalities that we need to have. And probably even if we need to meet like the other players, like the MOH, will have got contacts and informed them of our partnership.
Great.
So
great.
Yeah.
Okay, so then Abdul, you'll take the ball and schedule to meet with our mPharma friends, and then why don't you keep us abreast of when you're ready for the next meeting, because you don't have to do all 4 things, but maybe we start with 1 or 2. It's up to you guys to say, let's stage this, or let's do all 4 at one time, or, do what you think is the best way to address this. And I know Abdul knows Kibra like the back of his hand. He's very practical. He's, very responsible. And I'm sure that between you and each other, you'll come up with a really good plan to start. And then, we can talk about what it entails and then go from there. So Harriet and Charles and Abdul.
Milka.
Mission.
Yeah, sounds great.
Good. So
Perfect.
Who's going to head from mPharma? Is it Harriet or Charles?
Should be Dr. Harriet.
Dr. Harriet. Okay, Dr. Harriet and Abdul, we'll leave it in your hands, and then just keep us in touch with where you are and when you want to meet the next time to discuss this with us.
Sure, that's okay.
That will be fine.
Good, because it's exciting, and it will make a huge difference for the people in Kibra. And, this could be a model for mPharma and other low income communities around Africa, whatever countries you're working in, because you need somebody on the ground that knows the area and knows the people to come up with the right strategy. Because I see, being there, it's not so easy. People don't understand, they're not educated, they don't have any money, but somehow you will solve it. You will come up with a great model. I'm confident of it.
I agree.
Yeah. So everybody,
You guys are gonna do it, I can tell.
Oh, it's going to be great. It's going to be great. It's going to be, it'll be a case study at Stanford University. healthcare in low income areas throughout Africa. This is how it's done. So I really believe that. So I trust in all of you and I applaud you, mPharma, for doing this business. It's great. It's such a need for the community, and we thank you. So does anybody else have anything to say before we end the call?
I think I will communicate with Charles so that at least he can get me like the contact of Harriet, so that the first thing I think, if I can meet with the team, or if I can meet with Harriet, so that at least we can come up with the modalities.
I have Harriet's contact information, Abdul, so I'll send it to you. And I'll send a recording of this meeting so you can always refer back to it. And then and Abdul will get back to us when you want to plan the next meeting. And we're here to support what your efforts are. That's for sure. Okay, so thank you, everybody.
Thank you all.
Thank you too.
Yeah.
Thank you.
Thank you.
Nice meeting you, Charles.
Bye.
Yeah. Thank
Okay.
you. Thank you, Nancy. Thank you, Elliot.
Yeah, nice seeing you again.
Pleasure.
Everybody.
And Milka.
My pleasure.
Okay.
Okay, bye.
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 Bye.